be a patient. I have only seen things from a nurse's perspective, where you can't afford to get too emotional or involved. I often wonder what it must be like to be on the other side, to be lying in bed, to see things through a patient's eyes. The only way I have of imagining is to use my experience of the way people in the past have reacted to being in my care. What I have noticed is that a person's behaviour generally changes as soon as they become a patient. Some people become extremely nervous, which is understandable, and may explain why some pretty silly questions are asked. Does surgery mean I will have to have an operation? Then, there are the people who, during a ward round with their consultant, will nod as if in understanding, but when the doctor leaves they haven't the faintest idea what is going on. I've heard many a patient, when asked by their consultant, "How do you feel?" respond by saying that they feel fine, when in fact they'd spent the morning complaining about their ailments. Some people suddenly find they are unable to do simple tasks for themselves, like pour their own water or fluff their own pillows, even if they're physically quite capable. Others become so used to being in hospital that they know how a ward runs better than some of the staff. Some become so demanding that no matter how many of their requests are satisfied, they will never be happy, while others are so grateful for any small service, even just spending 5 minutes listening to them, that they want to shake your hand or marry you off to one of their grandchildren. I've seen people too afraid to disturb the nurse, as they don't want to be a burden, even though they are worried about the pain in their chest. I've seen others treating nurses like servants. Then there are people who lose all initiative because they aren't sure what they're supposed to do. They don't know how to be a patient, and they're not sure what exactly a nurse's role is. When I picture myself sitting for hours in the waiting room, seeing patients who came after me being dealt with first, I wonder whether this would irritate me, or whether I'd be calm and rational, like all nurses want their patients to be. Then, when I finally get called through to see the doctor, I imagine expecting the doctor to have all the answers to my problems as doctor knows best. It must be frightening for patients who are admitted to be put on a drip, to have blood taken every day, or tubes stuck in some surprising places. For some, having to share a room with a bunch of sick strangers might seem difficult. But that's why I'm here, your average nurse. It isn't just about giving you your medicines and dressing your wounds. I'm here to explain things, including the foreign language the doctors use. I'm here to help you in and out of bed, to help you help yourself. I'm here to help calm you in the night when you wake up wondering where you are, or worrying about that pain in your chest. I'm here to help make your treatment as bearable as possible. 1. Slippery beginnings. Did I always know what I was doing? Of course not, but I couldn't tell the patients that. A nurse must be confident and assertive, yet caring. The problem was, I didn't feel confident, nor the least bit assertive. I did care, though. I will never forget my first day at Allswell, a hospital situated in the middle of nowhere. Well, maybe more like everywhere. Allswell was a fairly typical example of all that is good, bad, outrageous, and hilarious about hospitals across the civilized world. I remember vividly the reaction as I walked into the ward and explained I was the new nurse. Mouths dropped open, and there were mutterings of, "There must be some mistake," and even, "This is a joke." The nurse in charge of the ward even made a phone call to the head of personnel to explain the problem. You see, I was not just straight out of college. I was the only male in a gynaecology ward. The most important people I met that first day were Sharon and Cherie. Sharon was the nurse in charge of running the ward, similar to a traditional matron. Cherie was the nurse whose job it was to familiarise me with the ward. It was a huge responsibility for her, although I didn't realise it at the time. Over the next 2 months, Cherie's task was to transform me from a naive new graduate to an effective, safe, and efficient member of the team. I don't think either of us knew how difficult that was going to be. My first day was spent following Cherie around. I was introduced to every patient and shown where everything was: the fire escape, cardiac arrest alarms, cardiac arrest trolley, treatment room, sluice room. I was handed a 3-inch thick folder of policies.